Two people can sit in my office with the exact same cholesterol number circled on their lab report, and one of them is quietly heading toward a heart attack while the other is perfectly fine. The standard test most of us get every year cannot always tell them apart, and almost nobody explains that to you. I am Dr. Hale. In my 15 years in internal medicine, I have watched more people get frightened by a cholesterol number than actually helped by it. They see one bold figure at the top of the page, the total cholesterol, and their whole sense of their heart rises or falls on it. Sometimes that number is doing them a favor. Sometimes it is misleading them. And if you are anywhere from your 40s to your 60s and beyond, this is the stretch of life where knowing the difference genuinely changes what happens to you. Because plaque does not build overnight. It builds over years. Quietly. While your labs still look acceptable. So today I am going to walk you through the myths about cholesterol that I hear in my office every single week, and the plain facts underneath them. What the good and the bad cholesterol actually do. Why the single number your doctor circles is not the whole picture. The one about eggs that almost everyone gets wrong. And the honest truth about statins, which are neither poison nor a magic shield, no matter what the internet shouts at you. Stay with me, because the myth at the end, the one about the drug so many of you are afraid of, is the one where the fear and the facts point in opposite directions. Let me start with what cholesterol even is, because the whole thing makes more sense once you see it. Cholesterol is not some invader. Your body makes it on purpose. It uses cholesterol to build the walls of your cells, to make certain hormones, and to help you digest food. You need it. The problem is never that cholesterol exists. The problem is how much of a certain kind is riding through your bloodstream and how it travels. Here is the picture that makes it click. Cholesterol cannot float through your blood on its own, because blood is watery and cholesterol is fatty, and the two do not mix. So your body packs it into little vehicles made of protein. According to the American Heart Association, the ones we label LDL, the so-called bad cholesterol, act like delivery trucks carrying cholesterol out to your tissues. When there are too many of them, they start dumping their cargo into the walls of your arteries, and that buildup narrows the pipe. The ones we label HDL, the so-called good cholesterol, work more like cleanup trucks. They pick up extra cholesterol from the artery walls and haul it back to the liver to be broken down and cleared out of you. So it is not one number, it is a traffic pattern. Delivery trucks piling cargo into the walls, cleanup trucks carrying it away. And this brings us straight to the first myth. Myth number 1. The total cholesterol number is the whole story. It is not. The total is really three things blended into one figure, and the blend matters more than the sum. The National Heart, Lung, and Blood Institute describes total cholesterol under 200 as desirable, 200 to 239 as borderline high, and 240 and above as high. That is useful as a first glance, but picture two people who both land at 220. One of them got there with high LDL and low HDL. Too many delivery trucks, not enough cleanup. The other got there with moderate LDL and very high protective HDL. Same total. Completely different roads ahead. If all you look at is the one bold number, you cannot see which person you are. That is why your doctor should be looking at the breakdown, your LDL, your HDL, and a third number that gets ignored far too often, your triglycerides. Triglycerides are the most common type of fat in your body, and they are how you store extra energy from food. The American Heart Association notes that when high triglycerides show up alongside high LDL or low HDL, that combination is linked with fatty buildup in the artery walls and a higher risk of heart attack and stroke. For a lot of people in their 40s and 50s, especially anyone carrying extra weight around the middle or watching their blood sugar creep up, The triglycerides are the number quietly waving a red flag, while everyone stares at the total. So the next time you get your labs, do not accept one circled figure. Ask to see the split. And there is a deeper layer, which leads me to something most people have never heard of. Myth number 2. My LDL number tells me exactly how much danger I am in. Not always. Here is where it gets interesting, and the American Heart Association actually uses this same comparison. Your LDL cholesterol number tells you how much cholesterol is being carried through your blood, but it does not tell you how many trucks are carrying it. There is a measurement called ApoB that estimates the actual number of those particles. Think of it like counting cars on a highway. The LDL number tells you how much cargo is on the road. ApoB tells you how many vehicles are crowding the lanes. And the number of vehicles is a big part of what damages the artery wall. Why does this matter to you? Because two people can have the very same LDL cholesterol number, while one of them has far more particles carrying it. In some cases, the LDL number looks reassuring and healthy, while the particle count is actually high, and a standard lipid panel does not fully show that person's risk. This is not something you need to memorize. It is one question worth carrying into your next appointment. If you have a family history of early heart disease, or your numbers and your risk do not seem to line up, ask your doctor whether an ApoB test makes sense for you. It is a simple ask, and for the right person it changes the whole picture. And while we are clearing up confusion, let me handle a smaller myth that trips people up. Many folks believe HDL, the good kind, is a number you should try to drive as high as possible, as if more is always better. The American Heart Association points out that the story is not that simple. Higher HDL is generally linked with lower risk, but chasing an ever bigger HDL number is not a proven way to protect your heart, and very high readings do not automatically mean you are safe. So do not fixate on any single line as a trophy. What your doctor is really watching is the whole pattern over time and how it trends from one visit to the next, not one number frozen on one bad or good day, which is exactly why checking your numbers every few years, and more often if they are borderline or you are working to improve them, tells you far more than a single snapshot ever will. Now let me hit the myth I get asked about more than any other, usually at breakfast. Myth number 3. Eating cholesterol, like the cholesterol in eggs, directly raises the cholesterol in my blood. For most people, this one is far weaker than you were taught. For decades, eggs were treated like a loaded gun for your heart. The science has softened a great deal since then. The cholesterol you eat and the cholesterol in your blood are not the same story, because your liver makes most of your blood cholesterol itself, and when you eat more, your liver tends to make less to balance it out. For roughly 2/3 of people, dietary cholesterol from something like an egg has only a small effect on blood cholesterol. Newer research suggests that dietary cholesterol on its own is unlikely to substantially raise the risk of heart disease or stroke in otherwise healthy people. Now let me be honest, because this channel lives on honesty. That does not mean eggs are a free pass for everyone. Some people are strong responders, and their bodies do push cholesterol up more when they eat more of it. And an egg is rarely the real problem anyway. It is the bacon, the buttered toast, the sausage, and the fried everything that usually travels with it. The bigger movers of bad cholesterol for most people are not eggs at all. They are the saturated and trans fats and the refined carbohydrates that fill the plate around them. So the honest takeaway is this: an egg is not the villain the old poster made it out to be. The company it keeps matters more than the egg. If this is helping you see your own labs more clearly, do me one small favor. Subscribe to Dr. Hale and tell me in the comments how old you are, because the ages of the people watching genuinely shape which topics I cover next. Then stay with me, because now we get to the myth where fear and fact really collide. Myth number 4. Statins are poison, and a natural person should never touch them. I want to handle this one carefully because you have probably heard loud voices on both sides, and neither the cheerleaders nor the fear peddlers are being straight with you. So let me give you the balanced version, the one I actually say across the desk. Statins are medicines that lower LDL cholesterol, and for the right person, the benefit is real and well established. The American Heart Association reviewed the safety of these drugs in a scientific statement and concluded that for people who need them, the benefits far outweigh the risks, and that serious side effects are uncommon. Some people do get muscle aches, and that is worth taking seriously and reporting to your doctor. But here is the part the fear videos leave out. The Heart Association also warns that if you think a statin is bothering you, the move is to talk to your doctor, not to quietly stop the pill on your own, because stopping a statin can meaningfully raise the risk of a heart attack or stroke in someone who genuinely needed it. At the same time, I am not here to tell you everyone over 50 should be on one. That is not true either. The guidelines built around the Heart Association and its partners focus statin decisions in adults roughly 40 to 75 on your overall risk, not on a single number in isolation. Your LDL, yes, but also your blood pressure, your blood sugar, whether you smoke, and your family history, all of it together. The higher your overall risk, the more a statin tends to help. The lower your risk, the more it becomes a genuine conversation with room for your own preferences. So the honest position is not statins good or statins bad. It is this. Statins are a real tool, not a villain and not a candy. Whether one belongs in your life is a decision you make with a doctor who knows your whole picture, not one you make from a comment section. That is the debunk. Both extremes are selling you something. The middle is where the truth sits. Now you might be wondering what actually moves these numbers if it is not the egg you were told to fear. The answer is unglamorous, and that is exactly why the internet ignores it. The American Heart Association points people toward a pattern of eating and living rather than a single magic food. More soluble fiber, the kind in oats, beans, lentils, apples, and barley, which grabs cholesterol in your gut and helps carry it out of the body. Swapping the saturated fats, the fatty and processed meats, and the butter for healthier fats like olive oil, nuts, avocado, and fatty fish. Cutting back on the sugary drinks and refined carbs that push your triglycerides up, and moving your body most days, which tends to raise the protective HDL and lower triglycerides at the same time. None of that is exciting. All of it works, and it moves the numbers that matter far more than obsessing over one food ever will. Let me bring you a person now, because numbers land better with a face. I will call him Ray, a composite of many patients I have seen, 51 years old. Busy, active, felt great. His total cholesterol came back at 230, and he panicked, ready to overhaul his entire life out of fear. But when we broke the number apart, his HDL, the protective kind, was actually high. His triglycerides were reasonable. His overall risk, once we added his normal blood pressure and the fact that he never smoked, was modest. Ray did not need panic. He needed a few steady changes and a recheck. Now picture a second man, same total of 230, but with low HDL, high triglycerides, a father who had a heart attack at 50, and blood pressure creeping up. Same headline number. Completely different plan. That is the whole point. The number on top of the page is a headline. The story is underneath. So let us pull this together into what you can actually do, starting this week. 1. The next time you get labs, do not accept a single circled number. Ask to see your LDL, your HDL, and your triglycerides broken out, and ask what your overall risk looks like, not just one figure. 2. If your numbers and your family history do not seem to match, Ask your doctor whether an ApoB or particle test makes sense for you. One question, potentially a much clearer picture. 3. Stop blaming the egg and start looking at what surrounds it. Cut back on the saturated and trans fats and the refined carbs, add more fiber and vegetables and fish, and move your body most days. That combination shifts the numbers that matter more than fussing over one food ever will. 4. If a statin is on the table, do not decide from a video, mine included. Bring your whole picture to your doctor and make the call together. And if you are already on one and something feels off, call your doctor before you ever stop it on your own. Now the part I never skip. Everything I gave you today is education, not a diagnosis. And it is not a replacement for your own doctor, who knows your history, your medications, and your body in a way no video can. And there are signs that are not about slow numbers at all. Crushing chest pressure or pain. Pain spreading into an arm, the jaw, or the back. Sudden shortness of breath, a cold sweat, or a feeling of doom. Sudden weakness on one side, a drooping face, or slurred speech. Those are not cholesterol conversations for next month. Those are a 911 call right now. Do not drive yourself. Do not wait it out. Here is the thread I want to leave you holding. Everything today was about seeing your own risk clearly instead of being scared by one number or fooled by it. But cholesterol is only one of the quiet forces shaping your heart. And there is another one sitting in millions of medicine cabinets right now that most people never connect to it. In my next video, I am going to show you why the everyday supplement so many of you take for your heart may be doing almost nothing in the form most people are buying, and how to tell if yours is working or just making expensive fishy burps. Subscribe so it lands in front of you. Whether you are 45 or 75, you are never too early and never too late to understand your own numbers. And the version of you 10 years from now will be grateful you stopped fearing the headline and started reading the story. I am Dr. Hale. Take care of yourself.